So end-stage renal disease. It means there is no way back. Your kidneys failed. You got only 50 milliliters per minute or even lower. So you are not able to filter the blood. You're not able to get rid of toxins, and you will die if we won't dialyze you. But dialysis is not such a great synonym, because also you dialyze people in acute kidney injury where there is a high probability that the patient will survive and kidneys will survive and he will function. So rather, the best synonym for end-stage renal disease is transplantation. Because end-stage means you are not able to work anymore and you need new kidneys. And still, if I will recap it again very fast, it means uremic syndrome with all of its consequences. So over here you will mention pericarditis, you will mention colitis again, you will mention encephalopathy, you will mention thrombocytopenia and bleeding. Yeah. So thrombocytopenia, as we talked about with nephrotic syndrome, again, I'm repeating, in nephrotic syndrome, before you fail fully, which can take several months or years, with a nephrotic syndrome, you're going to rather clot. You're going to have strokes, you're going to have DVT and pulmonary embolism. But once your kidneys will fully fail and you're in end-stage renal disease, bleeding will take over because the platelets will not be working. Also, white blood cells will not be working, so you're going to be immunodeficient. You can have infections and you can have also cancer, unfortunately. So you are really badly protected. Moreover, as let's say, as this was only uremic syndrome, but don't forget hyperkalemia. This can kill you right away. So always ECG with end-stage renal disease. Monitor the patients. And remember anemia, of course. I'm just repeating it. Remember, no vitamin D. So there's osteodystrophy. Okay. And over here again, the hyperphosphatemia when I was talking about chronic kidney disease. So again, oral phosphate binders. If you want to know one name, sevelamer, increased phosphate. And one of the oral phosphate binders, if you want to know a drug for future, sevelamer. That's a typical one. And also don't forget about hypermagnesemia. So don't drink or eat stuff with lots of magnesium. You have enough of it. Okay. And bleeding I have mentioned. I didn't mention pruritus. It's called uremic pruritus. It's like itching of the whole body. Very typical with uremia, but the pathophysiology is unknown. It's unclear. Whether it is due to uremic toxins or whether it is due to some kind of diffuse inflammation or neuropathy or even due to some opioid imbalance, we don't know, but it's described, it's very common, and it is very debilitating. Okay, and the thing is that it is resistant to antihistamine therapy. And first of all, in all of the cases, please remember, because the immune cells are not working, and one of their function is also clearing the atherosclerotic plaques. That's one of the theories. Anyways, atherosclerosis is the main problem. The same as with nephrotic syndrome. Always think of strokes, think of MIs, and a high risk of blood clotting and occlusion of the arteries and also veins. But over here now, if we talk about atherosclerosis, of course, I mean only arteries. Okay, so watch out. So end stage is a pretty awful end. So on this sad note, we're finishing our series. Questions? So, thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.